This is what I see.
This is what I see.
This is what I see.
But I can't see a dentist.
At some point, people have to get scared about that, and we have to do something.
We have to do something because Kansans all over the state, from all walks of life, have trouble finding a dentist. That's because the shortage of dentists is a very real problem. It's a problem that affects not only the overall health of Kansans, but also the economic viability of our communities.
She was 16 years old. She had pain in the back part of her face for a couple weeks, and she had just been switched to a different foster home, and she'd been previously told it was wisdom teeth. She got to us, and this poor girl hadn't eaten for 24 hours. She wasn't able to open her mouth. She was crying, hysterical in pain. She had only been able to crush up ibuprofen because she couldn't open her mouth far enough. We got a hold of her. We took an x-ray that takes a view of the whole face because we couldn't get anything in her mouth. And it didn't appear to be tooth-related. It was a little further back. And this is the downfall of being in a rural area. Had to get her into an oral surgeon because we knew it was something we couldn't fix. She needed to be hospitalized. It was definitely, more complex than what we could do. I ended up taking her to the ER after she started throwing up blood from having no food and being in pain and being so miserable. She ended up having to go to Wichita, so a 4.5-hour drive with her foster parents.
There was a young mom that came in, 26 years old, who she had some major issues with her teeth. They could not be saved and had to be extracted.
We do dentures for women of working age so that they can get jobs. You would not believe the difference it has. You talk about making an impact on someone's life. Getting them a job is huge impact.
A typical patient would be someone who, is blue-collar worker, is out there trying to provide for their family.
She is between 25 and 50, and she's a single mom, probably. That's who we take care of. And how important is it to take care of our mothers and make sure our moms can be good moms and make sure that they have oral health care and then our dads can be good dads.
They may not have seen the dentist in 15 or 20 years. They hear about the dental clinic maybe from one of their friends or from a family member, and they have a tooth that's been bothering them for a long time, but they just deal with it because, it's not a priority, and they're more worried about their kids.
We should all be worried about the number of Kansas children who can't find dental care. It affects their overall health, their performance in school, and their ability to learn. In fact, children in the U.S. miss more than 1 million days of school each year because of dental-related problems.
And with kids, it affects their learning. Kids, especially little ones, they don't know how to relate what's going on near as well. It affects their attention span. They can lose days of school.
If students are in pain, they can't learn. That's the bottom line. If I am sitting in class and learning math, it's very difficult if my focus is on my mouth, my pain that I'm feeling at that moment.
What scares me, and we talked about this earlier, is that children die from dental problems. And most people don't correlate the fact that dental disease is, number one, that's the most prevalent disease in children, and that it can cause severe health problems. In 2007, a 12-year-old boy by the name of Diamante Driver died from an access to care issue. He was on Medicaid. Couldn't find providers that would take care of his problem. Ended up with a systemic infection, went to his brain, had surgery, and died. And it shocked the nation.
That infection or type of infection is not uncommon. We see it every week.
We can't allow children to die because of an access to care issue. So we've got to change the model so that all children deserve the right and have the right to have good, regular dental care.
Senior citizens are also among those most affected by the dental shortage in Kansas. Not all dentists accept Medicare, and because of state budget cuts, programs that once helped elderly Kansans find dental care no longer exist.
It's a complex problem, especially in the nursing homes. Generally, you have people with Alzheimer's or other dementia issues. They don't travel well. Being seen in their own home where they live, they're settled down, they do better, and you could have a dental therapist could go in and see those patients and alleviate the cost of the nursing homes, alleviate the stress on the patient.
Nursing home care is so important. Gum infection makes infection of the heart. You get a heart attack, stroke, you don't get healthy. Diabetic, oh my gosh, your blood sugar will never be right if you don't get rid of your infection in your mouth.
Someday, when the students who are sitting in the classrooms right now are looking back at me, Mrs. Stovall, who may be retired by then, I want them to consider my health and I want to give that to them now so they will consider me when I become an older person to really provide that healthy services that I may not be able to afford by then.
Let's not wait for someone else to fix our problem. Let's fix this ourselves.